My name is David Dingli. I'm a consultant in the Division of Hematology at Mayo Clinic in Rochester, Minnesota. I'm here to talk about an uncommon syndrome called Schnitzler Syndrome. This is an important condition for a number of reasons that will become apparent as this talk continues. Schnitzler Syndrome was initially diagnosed in the early 70s when it was noticed that some patients with a chronic urticarial rash had a small monoclonal protein in their blood, typically an IgM kappa. Patients with Schnitzler syndrome usually have a variety of additional symptoms, such as fever, bone and joint pains, muscle aches, fatigue, enlarged lymph nodes. They're often anemic. They can have enlarged liver and spleen. Typically, patients with this syndrome have this peculiar rash that often is described as urticaria, that is resistant to most forms of standard therapy for this condition. The rash tends to be pink in color. It can affect most parts of the body, although rarely it affects the face and hands. And it comes and goes. Typically, the rash appears and within 24 hours, it resolves. However, new lesions tend to form. It is very rare for a patient to be free of the skin rash for more than a month at a time. Patients are usually quite troubled with high fever, and they tend to have fatigue, especially if they become anemic. Often patients are seen by dermatologists initially, but this condition has to be thought of, and testing for seroprotein electrophoresis performed, because if this monoclonal protein is present, then the chance that the patient has this syndrome is substantial. We have looked at this condition at Mayo Clinic for many years, and we have had a substantial number of patients with this disease. Recently, we have figured that it is highly likely that many patients with this condition are not being diagnosed appropriately. And we think that for every patient that out there with Schnitzler syndrome, there are probably 3 more that would have had the disease but were not diagnosed appropriately. This condition, albeit rare, can mimic other important conditions, such as hypocomplementemic urticarial vasculitis, Waldenstrom's macroglobulinemia, Muckle-Wells syndrome, hyper-IgD syndrome, cold urticaria, and others. Because there is specific therapy for this condition, it is essential that patients are seen at a center of excellence where physicians have expertise in recognition, proper diagnosis, and therapy for this disease. And at Mayo Clinic, we have a group of dermatologists, hematologists, rheumatologists, and radiologists who have a specific interest in this condition. As I mentioned, it is critical that the disease is properly established, because there is a fine line between diagnosis of this condition and other clinical scenarios that may be similar, but will not respond to specific therapy that exists for this condition. In our experience, patients with Schnitzler syndrome are often delayed in their diagnosis with a median time of about 5 years from the onset of symptoms. And one can imagine the morbidity that these patients go through and the frustration in having symptoms that are recalcitrant to any therapy, not to mention the fever, the fatigue, and often, and this in our experience again, this is underdiagnosed, peripheral neuropathy. There is specific therapy that is often well tolerated, and therapy works like magic in this condition. If patients are properly diagnosed and they are treated with a medication called anakinra, the response is within 24 hours, generally complete, and patients feel like a new person. Therapy has to be continued because the disease rapidly relapses. Patients at Mayo Clinic where Schnitzler syndrome is diagnosed can expect to be seen by a multidisciplinary team that will typically require a dermatologist who will often perform a biopsy. This biopsy is quite critical to distinguish Schnitzler syndrome from other causes of urticaria and other conditions that can mimic Schnitzler syndrome, such as vasculitis. Often, patients will see a hematologist because of the associated anemia, high white cell count, and often high platelet count, together with enlarged lymph nodes, liver, and spleen. We often ask the patient to be seen by a rheumatologist to exclude other conditions such as systemic lupus erythematosus and Still's disease. And patients can expect investigations including imaging studies looking for the typical bone lesions that can occur in about 40% of patients with this disease. One would expect the patient to be here for about a week to be able to establish this diagnosis, visit with all the relevant specialists, and once we establish the diagnosis, we discuss the plan of care, including side effects that one can expect from medications and how follow-up can be arranged. We do not understand the biology behind this disease, but it's becoming clearer that autoimmune phenomena that stimulate cytokine release are at the root of this problem. The presence of a small monoclonal protein in the serum is very common, and it's present in about 1% of the population at the age of 50 and can go up to about 8% as we get older and approach the age of 80. Urticaria is also a very common condition. So having urticaria and just this protein by itself does not mean that the patient has the syndrome. However, if the monoclonal protein is an IgM, then the likelihood that the patient has the syndrome is actually quite substantial. In our experience, up to 1% or more of patients who have an IgM monoclonal protein in their serum have the Schnitzler syndrome. This is similar to other conditions that are linked with MGUS, as we call this protein. Therefore, a high index of suspicion is critical, and Schnitzler syndrome has to be considered in the diagnostic evaluation of a patient with what looks like resistant urticaria in the presence of a small monoclonal protein. I have to emphasize that this monoclonal protein can be quite small, and it requires fairly sophisticated testing to be sure whether it is present or not. If it is present, it has great significance in the context of the urticaria for that particular patient.